Well, good evening, bonjour, bonsoir tout le monde. Wonderful to be here. Wow. Yes, I'm Bonnie Crombie. I'm leader of the Ontario Liberal Party. Honored to be here to recognize the incredible contributions that nurses have made to our province, and I think this is now the second year in a row, and counting, I hope. So let me first say how very special it is to be here tonight on your 100th, yes, annual general meeting. This is a testament to all of you and, of course, to your hard work for a century now. Wow. The Registered Nurses Association of Ontario has been at the heart of shaping public policy. No, Doris hasn't been there the entire time, but sometimes, you know, it's been a lot. How many years of it has it been, Doris? There you go, almost a third of it. Delivering care that Ontarians rely on every single day, and you really are the backbone of our healthcare system. I want to thank your president, Lamo Dolkar, and of course Doris, how can you not, Dr. G, as Minister Calandra calls her. Thanks for having me here, but thank you all for your tireless work, because you are the voice for health, for equity, and also for dignity for the profession. Doris has been a trusted partner, a fierce challenger. No one would not heed Doris's calls, honestly. I get this call to action, probably Ministers Calandra and Minister Jones and Marit and Ashland do as well. It says, retweet this now. On WhatsApp, do you all get that, or is that just me? Because I feel like it's to me, right? Retweet this now, and I'm going, yeah, okay. Oh, wait a minute, that's not on theme today. We have a different theme today. And I'm like, who's that? Doris, jeez. But honestly, you don't mess with Doris, right? Because she has been around, as she told you, for almost 3 decades. And it was at RNAO's home office in 2008, way back then, that then Premier Dalton McGuinty announced the addition of 25 new nurse practitioner-led clinics, yes. A very transformative solution to primary care gaps in underserved communities. So today, those clinics serve tens of thousands of Ontarians, and despite promises from the current government, has done little to expand that model. So we're looking at you. We need to expand this successful model. Oh, we have Minister Calandra's commitment. Excellent. Our Liberal MPPs are hard at work for you, as you well know. Last night, as MPP Stiles has said, we were there late into the evening, debating and filibustering, and holding the government accountable at Queen's Park. We don't always agree, but we try to when we can. And we had one particular MPP who you know well, close to your heart. He couldn't be here tonight. He had to return to Ottawa, to Nepean, in fact. But of course, we're very, very proud of Tyler Watt, who is a registered nurse himself. Yeah. And Tyler understands what it means, because he feels it deeply to be a nurse, because he's walked the walk and he's served alongside you. And I've seen the work that he does day in and day out to bring your voices and your perspectives to Queen's Park. And he's doing an incredible job. I really think he's found his niche, and I want to thank him for that. Giving up nursing for him wasn't easy. I know he's going to continue to try to do some shifts, just like Dr. Shamji continues to do locum and to continue to do his shifts. Since becoming leader, I've been proud to work with RNAO and to build the relationship grounded in respect. God, hard not to respect your team, boy, especially Doris. The shared goals that we have that believe that public health care must remain public, right? That's right. But let's face it, I know I'm preaching to the choir here that Ontario's healthcare system is in crisis. I know the Ford government team in 2018 campaigned on ending hallway healthcare. Yet here we are, fast forward 7 years later and a couple of elections later, there are still 2,000 people lying on stretchers in hallways and in back rooms and in closets and in auditoriums, doorways. We have the lowest number of nurses per capita in Canada and among the lowest paid as well. And that trend line, sorry to say, is not improving. You've seen that $1 billion of your hard-earned taxpayers' money is going towards unregulated, for-profit staffing agencies propping up an already broken system. Honestly, that $1 billion could hire more than the 13,000 nurses and help fix the working conditions that nurses are facing, driving some of them towards those staffing agencies. That's the kind of investment that Ontario needs today, because it's the Wild West out there, frankly, and you're the ones paying the price. And I say, enough is enough. Nurses aren't just providers of care. You're leaders in your field, your academics, your advocates, your educators, and you deserve wages and working conditions that reflect your value. I'm going to say it again, but what happened with Bill 124 was insulting. Yes, and I know the government fought you in court and lost. Our hospitals are in disrepair, seniors are being failed, and wait times are growing. They're exploding, in fact. Yet, this government continues to underfund the system. Well, I won't. The Ontario Liberals will not. We believe in a strong, publicly funded, high-quality, accessible healthcare system where nurses and other frontline providers are respected and protected. A healthcare system where nurses can earn a livable wage. A healthcare system that is serious about regulating for-profit nursing agencies that are gouging our public system, because we can't let this American-style privatization continue. We need a government that has a plan to attract more nurses, especially in the northern and in the rural communities. You know, before I became mayor of Mississauga, I worked with my local hospital network. It was Trillium Health Partners, for anyone out there. I helped them fundraise, fill in the gaps, buy that necessary equipment with the fundraising dollars we collected that the government wasn't funding and filling in. And as mayor, I worked hand in hand with Trillium Health Partners, the CEOs, and the medical officer of health, and we got through one of the toughest public health crises of our lives. But I know I still have a lot to learn from you. You are the experts. We want to hear directly from you about what's needed, because you live it, and you know better than anyone else what's working and what's not working and how we can work together to fix it, because we can fix it, because we have to fix it, because Ontario deserves better. You deserve better, and I'm committed to working alongside you to make that happen. So I really want to thank you for allowing me to be part of this 100-year celebration tonight. Merci beaucoup, and let's get to work. Thank you.